One of the questions I'm sometimes asked is, what's the worst that can happen? Now, as a doctor, if you ask me that question, I have to tell you the worst that can happen. And the worst that can happen is death. I'm not aware of any reports of it actually happening, but that is the worst. One of the things that is reported is very rare. It's about 1 in a million, is blindness. So if you're treating putting fillers around the eyes, you block one of the arteries, you can make somebody blind. And I have heard of reports of that. The next area really would be if you can get death of skin or death of the tissues around that. Again, if you block the artery, you can get that. Treatment for those is breaking down the filler, and that's one of the reasons why we're using reversible fillers mostly, to actually minimise that risk. Other things that you can get, you tend to get allergic reactions. Now, the common allergic reaction that people are aware of would be, you inject something, somebody just goes, well, allergic reaction, that's like you've had a bee sting or something like that, and get the EpiPen out. I've never seen one of those, but we know that they can occur. The other type of allergic reaction really is sort of slightly later in onset. You can see weeks, months down the line, where the body tends to react to a substance that's put in and goes, oh, actually that's a foreign body, and get an inflammatory response to that. And generally that's treated by breaking down the filler, and a lot of time that will settle. Occasionally you may need to use some steroids, and sometimes you also use antibiotics because there can be a low-grade infection as part of that. You can, from any filler or any injection, get an infection. You've broken the skin, which is the safety barrier. More commonly, you get things like bruising. You're injecting, you're putting a needle into a face. The face is full of blood vessels, so that occasionally you will get a bruise. And then the other thing, you can get a bits of swelling, so that you can get swelling of the tissues. But most of the time, if you get swelling, it's a small amount of swelling that settles after a couple of days. But that varies from treatment to treatment. So what I tend to say to people is, look, yes, there are the worst things, but what we will do when you come in for the consultation and we're talking about treatment options is that we will go through what are the ones that need to be of concern and how we minimise that, because my role and my job is to actually minimise the risks that we are taking.